Hey, everybody. Welcome to Navel Gazing, the Valley Indy podcast. My name is Eugene Driscoll. Yesterday on this program, we had on Ansonia School Superintendent Dr. Joseph DeBacco. Today, I am happy to welcome as a guest back to this podcast or vlogcast or Zoom meeting or however you want to refer to it as, is Derby School Superintendent Dr. Matthew Conway. Welcome back, Dr. Conway.
Thank you very much. Thanks for having me, Eugene.
It's my pleasure. And it's the day before Thanksgiving as we record this. So I won't keep you for too long, but I am interested to learn about how Derby Public Schools are handling COVID, if nothing else for the fact that this is a moment of history. We've never experienced something like this in our lifetime. So just as simple as that, just to get it on the record of how things are going, I think is important to some extent. But before we get into some questions, and Dr. Conway is even going to be sharing screens because he's much better at Zoom than I am, I just wanted to read a quick message from the sponsor, valleygivesback.org. While giving back is always in season, now is a great time to plan your gift. Name a Valley nonprofit in your estate plan and create a legacy that tells future generations what mattered to you. With the planned gift, you have the power to impact the Valley forever without affecting your current lifestyle. Your action will inspire others to make a difference in their own way. Remember the Valley. Ask your accountant, financial planner, or attorney about planned giving options. Plan now, give later, impact tomorrow. Learn more at valleygivesback.org. And also, Toys for Kids is happening this year by Team Inc. If you go to Team's website, either on Facebook or Google that, you can learn how to help families have a wonderful holiday coming up here in the Valley. And valleyfoundation.org, a COVID response and recovery fund. Another round of applications is happening as we speak. So go to the Valley Foundation if you're a nonprofit looking for some grant money, or if you want to donate to help your neighbors in need and organizations in need. Okay, so how has Derby Public Schools managed to stay open thus far, Dr. Conway? We're talking COVID-19. My children have been home for about 3 weeks now. We're doing the remote learning. Ansonia is in remote learning until the new year. Same thing with Seymour. Is there some kind of magic happening in Derby, or what's going on there?
No magic, Eugene. I knock on wood at least 15 times a day these days. There's no one factor we can point to. There's no definitive factor we can point to why the numbers trend low while trending up are still trending low. We have an incredible, resilient staff who are just from every single position have just shown their love for the kids, even if uneasy, even if they have anxiety themselves or fear themselves with regard to this, as we all may, because it's such an uncertainty, have been there every day. We had one day where we ran into a staffing concern in terms of being able to cover all areas based upon contact tracing that needed to be done after a positive test. But we're able to bounce back the next day. And it's literally day by day, praying all of our staff keep doing what they're doing to allow us to continue the in-person learning for those of our families that want the in-person learning, as well as synchronously providing incredible instruction online for our families that have chosen online. And
I saw
a 30-70 split right now.
Say that again, Doc. I stepped on you.
37 are remote as of this week.
Okay. And I mean, as we talk, you're basically doing an experiment this week. Everybody in the district went remote for a few days to sort of test out the system. Would you have been able to do that? Because I was looking at some of the numbers. The numbers in Derby seem to be on an uptick, I guess, like they are everywhere in Connecticut. Would you have been able to do that regardless of your staffing right now? Would you still be in person if you could?
Yes, we could. So we did this specifically while it wasn't something we had to rush into, as we saw we had to do in March, or as as some of my colleagues have, reached a point in which staffing no longer allowed them to be in person. And when Seymour first went, Mike gave me a call on a Saturday morning. It had just reached that point where through the contact tracing and multiple positives in one day that he received made it impossible to open up on Monday. And so seeing that happen in surrounding districts, we wanted to make sure that we are 100% prepared should that day come, which for any one of us is a text, a phone call away, where we could find ourselves in that situation. So we saw a window to ensure that we're ready if we have to go at a moment's notice. Listen, everybody has had the laptops, everybody has had their hotspots for connectivity, but as a district, different from March to June, we wanted to test out if everybody is out across the district, with the exception of our pre-K program, our youngest learners, and those in our learning centers, if they were all out, what kind of issues would we see as challenging? What additional supports do teachers, paraeducators, parents, kids need throughout a day over that period of time, where we could have staff immediately addressing those and supporting those needs as they're coming up during the day. So if you're at home and the hotspot we gave you wasn't connecting, you have a hotline at each school to call. And if there's further diagnosis needed, bring it down to the middle school. We'll exchange it out, go back home, immediately jump on and try it again. So while we had people here ready to support and able to support, we wanted to test it out for the 3 days.
And this is the end of day 3 of this test. How did it go? And one of the things we talked briefly last week, one of the great advantages of being a small community in a small school district, you had mentioned if somebody has a problem and if need be, someone can drive to a house and knock on a door if someone's not in class or something like that. Of course, following every COVID thing under the masks and all that good stuff. But how'd it go so far?
So far, so good. We are surveying students next and families to get some additional data on their experience. But for anybody who not immediately logging in at the time they otherwise should have, that their class started, it was a team of people making phone calls to those homes to get those families online and connected. So we felt very good about the 3 days, being able to have people to support it, but also identify those areas that we need to improve on. But so far, all reports good. Teachers are reporting engaging students who are otherwise in person that were now online, that they were able to manage those appropriately. But we still have to look at all the data and really go class by class, teacher by teacher to get that feedback and from their experience, both from the students and the teachers and the paraeducators.
And one thing I noticed, Dr. Conway, is that I think yesterday the district sent out a questionnaire to families inquiring whether they were planning to travel this Thanksgiving holiday. And we're being advised from every level of government and common sense and science not to travel and not to have a large gathering. What's the motivation behind the emailed questionnaire?
To be able to gather as much information as we can of families who will report that they are traveling and staff traveling to one of the 47 states currently on the travel restriction list, so that we can properly inform those families that when they return, their child will have to be on remote learning for 14 days unless they can provide us a copy of a negative test.
And is there a sense that there's a lot of traveling? Like, what are you hearing in the community? Do you think people are going to adhere to the rules? Not to the rules, or at least stay home this Thanksgiving? I know I am. I got my cookies today and my black and white cookies. I'm all good. I'm not going anywhere.
So we hope people are, but we also know that people are going to travel, just as they will in any community. So we want to at least be able to identify those that are sharing that information with us, so that we can, provide them with the proper information in terms of what they need to do when they return.
And then one thing, switching gears, and I apologize for going all over the place, but my remote learning with my kids just ended, so my brain is fried. I felt bad for Dr. Tobacco yesterday because I couldn't get a word out. I couldn't get one sentence out without stuttering or stammering. But I want to draw attention to, maybe you don't live in Derby and you're watching this podcast. DerbyPS.org. You go there. That's the public schools website here in Derby, where I live. And just last week, I think, unless I had missed it, a live COVID-19 dashboard now pops up. And I find this so reassuring on a personal level because, you know, we've never been through a pandemic like this in Connecticut or the United States. And as a reporter, I have found it very difficult to get accurate information community-wide. You get some things from schools, you get other things over here. Facebook community groups might tell you that the gas station has COVID, but this is really good stuff. And I don't think anybody else in the Valley is doing something like this that I've seen. You can get current numbers, and it says, I don't know, is this accurate? I mean, you've been remote. Is this still, the numbers still good here?
100% accurate. And it's, well, it says our daily COVID metrics. So as our incredible nurses are entering the data into the dashboard throughout the day, the dashboard is automatically updated on the website as information is being entered into a database that we built to be able to populate the different fields in our dashboard.
And I mean, as of right now, it says 11 positive staff members and 6 students district-wide. In terms of the impetus to do that, why did you just decide to post that publicly on your website like that?
I've had it on my phone since day one. I built this out, Eugene, for my own, to be able to respond to questions, but have the information for myself on a daily basis to be able to track for the health and safety of everybody. So it was important for myself to be able to have this information readily available. But as we moved on and I began holding, went back to my weekly Zooms with parents and staff as I held during the summer, it became evident that this is something that all parents, staff in the community can have access to on a minute-to-minute basis. So initially it wasn't quite as colorful and fancy. It was, but took a little time to dress it up a bit, and so it was readable to everybody.
And Dr. DeBacco and Ansonia, although we didn't talk about this in my interview yesterday, he was quoted in another publication, I want to say CT Examiner, which is relatively new. I could have that wrong. But he was talking about, and he had said this previously, I think publicly, and in a conversation I had with him a few weeks back, in terms of contact tracing. Ansonia was in this position, especially administrators, where they were basically consumed not by COVID, the virus itself, but by the fact they had to do a ton of contact tracing because of the quarantine rules that say if you've been exposed to somebody, you need to quarantine for 14 days. And it led to them at one point, Ansonia Middle School had lost 30% of its staff because those staffers had to stay home. And I'm wondering, have you heard similar stories? Because we know like our local health districts were not set up to deal with something of this magnitude. In terms of contact tracing and the numbers that I mean, I get my daily NVHD report at about 10 o'clock at night, which I can only imagine is happening because someone's working until that hour. Have you had a similar experience in Derby in terms of not so much a lack of contact traces, but have you had to do that yourself?
Yes. So that is, and I have to thank our nurses are just absolutely incredible and tireless during, as always, and especially during these times, that because they're a phone call away from having to now spend a lot of time contact tracing. And between our nurses and our school administrators, they take on that role as soon as they get the phone call that somebody has tested positive. So whether that's a student or a staff member testing positive, once they get that phone call, we immediately start the contact tracing, because my notification then district-wide to staff and parents is completed after we have contacted anybody that could be considered a close contact under the current CDC protocols, so that they hear it first from the district administrator or the school administrator, and then the district notice goes out to everybody. But we wanted to ensure that at least the individuals that are directly impacted, where they'll have to quarantine, and we recommend getting tested, that they're notified first. And once that general notice comes out, it's also with the understanding and the message, anybody who's been considered a close contact has already been contacted, so that the people receiving the message throughout the district don't then have to worry.
It's just incredible to me how much school districts have done since March in terms of dealing with COVID, and just everything you just said there. It's quite remarkable what administrators, teachers, students, and families are going through here. So my hat's off to you I mean, how about in terms of just the day-to-day, or let me ask you in terms of preparedness or what you need, are there any resources or anything that Derby Public Schools is lacking in terms of responding to COVID and educating kids through a pandemic?
So not that we learn every single day in this profession. There's a lot of negatives to COVID, and it's causing a lot of death. If there's any good way to look at something like this, is it has, for all districts across the country, accelerated innovation, accelerated other ways of learning that we might have tried to work toward or experimented with over the past 15 to 20 years. But in the past months, it has accelerated in terms of the support for the technology to be able to integrate it, but also for the teachers, especially. They had to learn a whole new way of teaching, and students a new way of learning that we otherwise wouldn't have taken the time or been forced to do. And what I was amazed at is how much and how far they have come in the delivery of instruction online. And it's a challenge enough to do it synchronous to the students that are in person and online, when you're offering both models at the exact same time, for a teacher to manage that, but to also do it so well where I could sit in one of those classrooms. I could visit the different break rooms for small group instruction, and would never know the students that are in person in the classroom versus in a home, other than their background. So it was pretty amazing to see the engagement, and it's now scaling that across every classroom, every district, which is the next work ahead of us, so that every child is getting that same experience. It's been amazing to see what teachers have done, but it is at the cost of their own and sacrifice of their own time with their own family to make that happen. It's late nights for them, staying up and doing those different lessons for both to make it palatable for both in person and remote at the same time. So it's exhausting for them. And you may not see that in numbers in our dashboard while we're looking at cases, or we're looking at those that have been identified through contact tracing as having to be quarantined. The impact on staff also that you don't see in these numbers is those that are working through this and coming in every day, but with anxiety, with fear for their own family if they contract it, and the uncertainty every day while they're doing that. And to me, they're our frontline workers, like in our hospitals today, who are just going in every day, knowing the possible exposures, but still doing what they do. It gives you chills. It's unbelievable.
I agree 100%. And I'll just add to it. I think that's why we're told, and I'm just parroting what I've read elsewhere, but that's why it's so important. What I can do is just wear a mask. socially distant, try to follow the guidelines so I don't contribute to the fatigue of nurses and the healthcare industry and teachers who are just working every day through this, working to the bone every day. How do you keep morale up in a small district such as Derby, where I'm sure there are teachers working every day till 11 o'clock at night, midnight?
They are, and it's a toll on them. It's weighing on them. They're absolutely incredible, I have to say. But you know, I can't always comfort them by what they're asking. We are still asking an awful lot of them to come in every day, but they're still doing it. And even that, the recognition and the credit for it isn't comforting to all, given what they're experiencing. But it's listening, Eugene. It's being compassionate to what individual people are experiencing. So your experiencing with it, my experience with it, is different from anybody else that might be in this in a Zoom together as you're talking about it, and you learn a lot about your staff in those Zooms, talking through their individual experiences, whether it's in the classroom or what they go home with every day. So, because, you know, I'll be honest with you, even the experts that we turn to for the answers in this particular situation are just a step ahead. So we're kind of all novices at this. Even from an educational perspective, we're novices at what we're trying to keep going. From a health perspective, we're novices. We're all learning, even the experts are learning, and that information is changing and evolving every day. You know, in the beginning with our addendums for our reopening plan, we were getting revisions to the addendums multiple times a week because information changes. Even our data today, the thresholds by which you might look to change into a remote model. Back in June, the numbers for all schools due to the Harvard study was 25 cases per 100,000. We had it in our plan. In October, based on data over a couple months, that information changed and it became, well, it's not this hard line anymore, this hard number. It's more of a gradual, and here's the period where you begin to reassess. And you're not looking at one indicator of 25 per 100, you're looking at several different indicators to include your own district data within, as well as your community data.
Yeah. So how is Derby looking now, Doc? Because that's one thing I talked about that with Dr. DeBacco yesterday, and I just complained in general on Facebook. I've been frustrated by the fact that the state has said, "Well, keep kids in person as long as you can, keep them in person," and then you go to the red chart and it says, "Hey, if you're at this rate, you should consider remote learning." But at the same time, they're saying not. So it clearly conflicted. But you're saying, and then the spread in Derby has blew that mark away as it did just about everywhere in Connecticut now.
Yep. So, and when you look at the community, it's 15 per the 100,000. Now, in talking to DPH, and I am on 2 scheduled calls with DPH each week, and on those calls is our Dr. Carter, our epidemiologist, Dr. Sosa, and Tom St. Louis, our 3 health experts in the state and they're on that call twice a week, every single week, plus the calls in between to DPH if you need to reach out to them individually, or they will schedule a call if in between 2 days something becomes available to get out to everybody. So the information has changed such that the 15 that the community uses, that they use for communities, is really an alert for DPH and others to begin to deploy additional resources to those communities once they hit that 15 mark. The 25 mark for us originally was to then look to remote. Then it became a gradual, well, you might want to reassess if it makes sense to go to remote based upon these other indicators in addendum 4 to today. So in our call yesterday on Tuesday, and which was yesterday.
I think, I'm not sure about that. I don't know what day it is.
No, and I'm asking myself that now too, because So last Thursday and then again Tuesday, it was shared that 25 is no longer a threshold in addendum 4, though it's still, the chart is still in addendum 4. And that's why I reached back out to Dr. Carter and Dr. Sosa and said, guys, as long as that chart is in there, what you are informing me of on this phone call, I can't bring that back to people because the chart is still in addendum 4. And if you're saying it's not the threshold anymore, you have to remove it or I have to use it. But they're finding through their data that they don't know what the threshold is, but it's not the 25 from June. It's not even this gradual reassess at 25 today, according to Department of Public Health. According to our epidemiologist and Dr. Sosa and Tom St. Louis. So, but that's hard to then share with staff when it's still sitting there in addendum 4, which by the way was just updated October 21st. So as soon as the update came out, my Sunday noontime Zoom shared all the new updates with staff and parents. And then 2 weeks later, 3 weeks later, even that information has changed. And I live it minute to minute every day with the new information. So it's easier for myself to digest. It's much more difficult for somebody to understand, trust, and have the confidence in that it's accurate and right because it's being updated so often. And I get that, I really do. And I'm trying to be cognizant that everybody digests information differently in different ways. And when it continually changes, it just makes it that much more difficult. But that's how new this is to all of us. That's why even the experts I say in this, they're novices right now. If you look back to August, and I didn't see this article in August, Eugene, I had other data as to why we opened in person and not hybrid. But a Saturday morning, a couple of weeks ago, and I try and read as many articles as they come out as possible. I'm reading an article and from a couple doctors in Boston who actually said the hybrid is going to be devastating to the spread of COVID because of the 3 days home, 2 days in. And the kids are at home and then they're coming back in throughout a week. And we don't know when they're home doing online learning with maybe no supervision. Where are they? Are they at a friend's house participating in remote learning where they're not practicing the protocols? They're not sanitizing their hands, every corner they turn as they are in a school. And that would contribute to spread. And I couldn't even say definitively today, but the data would support that back in August, they were right. We are seeing a 37 now. It's gone from 30 to 32 to now 37 this week of the difference in reporting of districts with positive cases from those that were in hybrid versus in person. It's a 37% difference in number of positive cases reported between those two different models. So, and again, we won't learn what's definitive out of that for a long time, but I can at least see their data on a statewide level. That's a new dashboard that came out back in October also, that DPH working with CSDE puts out now weekly. They update it. And this week's update was up to 37%. But if you look at our own data locally here, it may or may not be a contributor to maybe why we're still open, other than the incredible contributions and grit of our staff that we still are. Maybe that's part of the reason for what we're seeing with our low numbers of transmission today amongst students and staff. But I can't definitively, point to that.
Yeah, at the end of the day, who was it? William Goldman, the screenwriter, Nobody Knows Nothing, whoever said that, or a Hollywood producer. At the end of the day, nobody knows nothing to a certain extent. Is there any, what are you looking at now as an indicator to consider switching to remote? Is there any one?
Yeah. I'm looking for it. But there isn't any one indicator. it may still come down to being able to staff at the correct levels. But you know, after the holidays, we will see what we are monitoring this closely to see what happens after Thanksgiving in terms of numbers. We're trying to look for additional data that Department of Public Health, as they're testing, can they collect information on of those homes with the positive tests, how many kids are in those homes. Even that information will help as we move forward, so we know, have maybe information or more information on households in which somebody has tested positive, how many kids in those households, how many are of school age, and so forth. Are they currently remote? Are they currently in person? You know, all of that information would help all schools in making these decisions. But, you know, there isn't a single indicator, certainly today, that anybody has said that's the one you have to look at. It's multiple indicators that we monitor daily and will continue to look at daily.
Okay, and then my last question. I mean, usually we talk every year around budget time. School budgets in Derby. I mean, I've been covering the community since 2009. They're always tough. Like, our community doesn't have a lot of money when it comes down to it. There's not a huge, and the money we do have comes from residents, you know, homeowners. We don't have that commercial base to sort of take some of the pressure off. And it's the tax burden over the years has shifted more and more to the residents. And then we have COVID, and I don't even know, I mean, there's been money available, but in terms of the upcoming budget, what is it looking like in terms of, I mean, in Derby traditionally, I mean, what you have, I don't even remember what you got this year. You had a bunch of years of no increase. So that catches up eventually. And now you've got a global pandemic that we're almost a year into. What's it doing to the budget?
So we've been fortunate with some of the CARES Act funding that has come through from the federal government that has helped all districts across the state to some extent. So certain items that you had to purchase in terms of the PPE and the sanitizing and the disinfecting has been supported. Those things have been supported 100% through that funding. And then other positions like our additional staffing for nurse assistants and monitors with our nurses, specifically for if somebody in our buildings has been identified as a close contact or tested positive or has symptoms, in terms of being able to properly manage that in the moment that it happens, to our bus monitors, to our additional 5 additional custodial staff just for the disinfecting alone throughout the day in our buildings. So there was additional CARES Act funding for those positions as well. So it did not today have an impact on our operating budget. And, you know, there is an expectation there'll be another stimulus package coming through Washington to all districts that will hopefully get us through the remainder of the year, because a lot of that funding was only good till the end of this current calendar year. So part of it is good till September of 22. The other portion is only good till December 31st of this year.
And Derby is Mark Izzo retired, right? Is that did I hear
not
that
yet?
right?
Thank God, not yet. He is.
Oh, did you say not yet?
Not yet.
Oh, he can't get out.
He has notified us that will be retiring.
Okay.
But he has not done so yet. Thank goodness. I don't know how I would get through this without him, but he is still here and just as steadfast as he has always been in his role. And it's just unbelievable what he does do and to help us get through this. So
sorry, I misspoke there. I was it's been a while since
But it is he has given us a date, but he's going to support us through this process and the transition to the new individual whoever that might be as well. So if, you know, a plug, if you're interested in becoming a business manager, and you, please reach out to me.
There you go. All right, Dr. Conway, I want to thank you very much for coming on. Totally impromptu. It's not like we prepared this in advance to talk about COVID. Thank you to you and your staff and everybody keeping Derby schools afloat and the kids learning. It's good to see and it's inspiring. And happy Thanksgiving.
Happy Thanksgiving to you, Eugene, if I could, because a colleague of mine gave me a quick shout out when he was on with you yesterday. But Dr. DeBacco and all of our my colleagues in the Valley region have just been tremendous to work with and through this process as we each experience daily different aspects of it. So shout out to all of them as well, and happy Thanksgiving to you and your family, Eugene.
Thank you, sir. Take care.
All righty.